Hi, my name is Katina and welcome back to my channel called Melanin Mouths. Now, it is a new year and I hope you guys are having a fabulous new year thus far. One of the things that I want to remind you, if you have not done already, today is January the 4th, so you still have time. I mean, come on. I want you to get this accomplished before the end of this month if you haven't already. I want you to think about some things that you want to get done this year, some goals that you just want to smash, some goals that you want to get accomplished. And I want you to write down those goals, and I want you to do something every day working toward that goal or those goals that you have set for yourself. I want you to think big, but I want you to start small. That would cause by the end of this year, cause you to manifest those dreams that and that vision and those goals that you have written down at the beginning of the year. If it's too big, let's just say, for instance, if you're thinking about losing 20 pounds in the month of January, that's unrealistic, because you cannot do that without having, doing like Jesus, without going on probably a water fast for 30 days. And if you've never done a fast for one day, how do you expect to do a fast for 40 days? And so again, with that being said, start small, but dream big. One of the things that I set a goal for myself in the New Year's was to start this channel. And so I'm going to be working on it, not every day, but I have set certain days aside that I am to film and to bring you guys content. And so this being the beginning of the year, at the end of the year, like in December 2019, I always talk to my patients that come in to see me to have their teeth cleaned. For many of you that do not know, I'm a dental hygienist, and so for those patients that come in the last month, they're trying to get in that second cleaning at the end of the year, and if they haven't been following good oral hygiene, or they have been lazy with their oral hygiene regimen, what I tell them to do, okay, put that on your to-do list, put that on your list of or your resolutions for 2020. And so we laugh about it, but I'm serious, because habits, sometimes they say habits, it takes 21 days to something to become a habit. But as a dental hygienist, I mean, I know that the struggle is real when you're trying to get patients to floss or to brush twice, on a daily basis, because, as working adults, we get too busy, or we don't think that it's important, or, whatever, and the things just happen. So I thought about the topics that I would bring to you in the beginning of the year. And so what I want to do is give you 5 tips for better oral hygiene. We can all use it. I don't struggle with my oral hygiene because, for one, I'm a dental hygienist and I practice what I preach, but there's other areas in my life, like exercising, that I struggle with. It can be a challenge for me. And so I'm just like you. It's just the struggle may be real in another area, okay, but not oral hygiene, like I said. And so I want to give you 5 tips to have better oral hygiene. And not only can you implement this, but also for your children. You can help your children with this as well. So the first tip that I want to give you is brushing. Now, if you should be brushing twice a day, and you should be brushing for 2 minutes, okay? At least 2 minutes for adults, and for children, under the age of, I say 13 or 12, you should be brushing at least 1 minute. So brushing will help remove that plaque, that biofilm that contains bacteria that can cause bad breath, and it can cause gum disease like gingivitis and periodontitis. And so what some of my patients ask me, well, which one is better? Should I be using a power toothbrush, or should I be using a manual toothbrush? And so it does not matter to me, which one you use. I just need you to brush twice a day for 2 minutes. Now, I do have those patients that do not do well. They don't brush well with a manual toothbrush. It may be their angulation, or they may just cut themselves short by brushing less than 2 minutes. And that's when I tend to really push or recommend to others a power toothbrush, because one, the power toothbrush it can be more effective for them. Also, a power toothbrush usually has a timer in it that will cause a person to brush for 2 minutes. And if you want me to discuss this in a later video about my favorite oral hygiene products, some great products, or some products that I can recommend to you all. And so going back, I need you to brush twice a day for 2 minutes. Say that, twice a day for 2 minutes. That's all I need you to do. Whether you're using a power toothbrush or whether you're using a manual toothbrush, I need you to just brush, okay? Another question that I get asked about brushing is what type of toothpaste I should use, or what brand of toothpaste I should use. And so I have my personal favorite, and I'll bring that to you in another video. I do have my personal favorite that I do like to use, but there's certain patients that may need something, may need something a little bit more different than a regular toothpaste, because their teeth may be sensitive, they may be a smoker, or if they drink excessive amounts of coffee or tea or things like that, then I will recommend something different. But again, I need you to brush 2 times a day for 2 minutes. So that's a tip that you can implement for the new year. The second tip I want to give to you is flossing, and you should floss daily. Now, I do have some patients that want to know, okay, should I floss before I brush or after I brush? It doesn't matter. It doesn't matter. If I have 8 patients that come to me, sit in my chair, and I clean their teeth, and if they are a daily flosser, I can't tell whether or not they brush in the AM, whether or not they floss in the AM or in the PM. If it's a patient that flosses every day, I can't tell. But I can tell if a patient flosses daily. I can just see it in the way that their gums look. If the gums are tight, and if the gums are pink, and if the gums aren't bleeding, I just know that they are flossing daily. So I can't tell whether they're flossing in the AM or in the PM, in the morning or at night. I just need you to find a time during the day to floss once a day. Okay? And so that's all I need you to do. Floss once a day. I need you to just find a floss that you like. Find a floss that makes your teeth feel clean. There's many different types of flosses out there: wax, unwaxed, there's woven. There's thick, there's thin, there's rope, there's rope, and there's a flat floss. And so just find something that you like and use it. Now, there are other alternatives to taking floss with your string in your finger and flossing your teeth. And again, I will go over that in another video. So flossing daily is important. It also doesn't matter whether or not you're flossing your teeth before you brush or after you brush. There may be some controversy, some fights, or some arguments in your home concerning, should you floss before you eat or after you eat? It doesn't matter, just long as you do it once a day, okay? And so the next thing that I want to talk about is brushing your tongue. Let's just go back to brushing your tongue, okay? Your tongue is that little member in your mouth that we need, and we need that to be fresh as well. We need that to be clean as well. And so brushing your tongue is very important, because the same bacteria that's on your teeth, that's along your gum line, it can accumulate on your tongue as well. And so it can also increase, bad breath as well. And so have you ever seen anyone with like their tongue and it looks like it's white, or it has some type of film on it, or it looks like it's black or brown? That can come from excessive, when a person has, some type of film on their tongue. That can come from excessive coffee drinkers, smokers. Also, it can come if it's yellow or orangish. It could be, someone can have the thrush or a yeast, infection in their mouths. Also those that experience dry mouths, maybe from medications of some sort or some type of ailment, can have a different color of your tongue. So, those things can be addressed, of course. But one of the things that I want to talk to you is most common thing that could cause the discoloration of your tongue, which is whether it's white or maybe it's brown. Again, white can come from like milk, a brownish or yellow colored tongue can come from drinking excessive amounts of coffee. You could be a smoker. If you drink something, that has a dye in it, like let's say like Kool-Aid, or some type of juice, pomegranate juice or orange juice can leave a certain coloring on your tongue. And so you need to brush that. I just had a patient just last week that came in, and he was my 8 o'clock patient, and I tell you, he did not brush his teeth. To me, I'm just like, oh my God, like how could you not? Even though you're coming to the dentist and I'm going to clean your teeth, and you're coming for a teeth clean, why wouldn't you brush your teeth and brush your tongue? Because I can have patients that come in and I know that they brush their teeth, but then their breath is not quite fresh, and I realize it's because they didn't brush their tongue. And if you're anything like me, I have ferocious morning breath. As a dental hygienist, it's just one of those things. I'm human, we're human. Somehow that bacteria that's just, during the night just go to 100th degree. And so if I just brush my teeth and not brush my tongue, oh my God, then my breath can still not smell fresh, And so you can brush your tongue with either your manual toothbrush or your electric toothbrush, or there's something that's called a tongue cleaner. You can purchase a tongue cleaner and use that. And tongue cleaners can come in like a metal form, or it could be like a plastic type of, you haven't been brushing your tongue, please try it. You'll find that it will make your breath fresher when you brush your tongue as well. And try to get that tongue, brush that tongue in the morning, and at night, I also have patients that tell me like throughout the day, they may find that, that their tongue, their breath isn't as fresh as it could be. Well, you eat breakfast, you brush your teeth in the morning, okay? And then while you're at work, you may have a snack, then you eat lunch. Let's say that you have a big burger. Let's say that you have a vegan burger with all the vegetables in it, and the onions, the red onions, and the cheese, the Gouda cheese, or the American cheddar cheese. Those things, can cause, onions and things can cause your breath to not be so fresh. And so what you want to do is, if you have the time, is brush your teeth after you eat lunch. In the dental office, when we eat lunch, whether it be noontime or 1 o'clock, whatever it is, when we come back before we see our patients, we're all in there brushing our teeth because we don't want those afternoon patients to smell our breath. We're all human, so our breath tends to get less fresh as the day go by. And so removing that bacteria, everything that have accumulated since your morning brush, will help keep your breath fresher for the remainder of the day. You can also chew some gum, chew some sugarless gum if you do not have the time, or even just go in and just take a rinse with some water, just rinse out that food debris, and that will help as well. Now I want to move on to my fourth tip that I want to give you, and that is using a mouth rinse. Now, do you have to use a mouth rinse? No, you do not, because if you brush your teeth for 2 minutes, and if you floss, and if so if you brush your teeth for 2 minutes, and if you floss, and if you're brushing your tongue, more than likely the mouthwash is not necessary. So it's not a necessity, but it can be beneficial to some people. And so I don't, even though I have mouthwash in my bathroom right now, I don't use mouthwash on a daily basis. I use it for special occasions. And what I mean by that, I love garlic, I love onions, so I eat a lot of fruits, I eat a lot of vegetables. And so and so when you're eating things like garlic, and when you're eating things like onions, that can leave a strong odor in the mouth. And so using some mouthwash will help decrease that odor as well. Now, I do have some natural products, some natural things that I use and it's very effective when you have those strong odors in your mouth. It's very effective. So let me know below in the comments if you want to know about, or if you know about those natural products that will be helpful and beneficial for those very strong odors. And if you have any recommendations, hey, if you have anything that you do and that you use, please leave it down in the comments below. So using a mouthwash can help. It can help decrease that bacteria. It can help kill that bacteria, and it can make your breath fresh. Now you may know some people that use mouthwash and do all those things, but they still have smelly breath. And so in those cases, that may be something, medical. Something else may be going on that may need to be addressed. It can be some issues with the stomach. It can be some acid reflux. It can be diabetes. These things tend to add more problems to just your normal smelly, stale breath. And so and also, gum disease. Gum disease don't just go away with mouthwash. It just doesn't. It's just like a little quick fix that may last maybe 10 or 15 minutes when there's other issues that's going on. So mouthwash is very important. It is not a necessity, but if you need to, mouthwash would be very effective. And the fifth tip is visit your dentist regularly. And what I mean by that is visit your dentist to get a professional teeth cleaning. We all need it. I mean, you should not be 30 or 40 or 50 and have not had your teeth cleaned professionally. There's going to come a day and time where you need it. And so we recommend that you get your teeth cleaned twice a year. So twice a year is sufficient. There are special occasions, and there are special times whereby, you need to get your teeth cleaned a little bit more often. Like say if you've had some type of periodontal disease in your past that's under control, or if you had some type of periodontal surgery that needs more of a regular maintenance schedule. And so we would love to see you, twice a year for your preventive cleanings. And that just helps things, stay healthy. It helps you stay on top of things. It helps catches things before they get bigger. Like, when you go for your normal routine dental cleanings and x-rays and exams, there's certain things that we can catch at a small state so that it doesn't, grow into something bigger. Like, a cavity starts small, but if it grows bigger, then you may end up having to need a crown, or even worse, a root canal and a crown. So visiting your dentist regularly will help you maintain, will help you prevent a lot of problems from occurring, and it will help keep your teeth, your smile, your mouth happy, and healthy. And so it's the beginning of the year. If you haven't already, you can schedule for your family to have their visit to the dentist starting this year. So think about it, okay guys? And so let me know if you like this video. Leave your comments below, and I'll see you next time.